Hantaviruses are viruses that are carried by some types of rodents. They can cause severe illness in humans, and they can be fatal. Human-to-human transmission is uncommon, though limited spread among close contacts has been observed in some previous outbreaks with one of the viruses, the Andes virus. WHO is working closely with authorities in Cape Verde, the Netherlands, South Africa, Spain, the United Kingdom, and the ship's operators to coordinate actions to ensure the safety and health of all people on board, while also limiting further spread.
Fresh developments in the hantavirus outbreak are reviving uneasy memories of the global panic scene during the COVID pandemic. Around 40 passengers reportedly disembarked at St. Helena as authorities rushed to trace possible chains of infection and exposure. Dutch national carrier KLM has now made a major statement regarding 2 passengers allegedly infected during the unfolding health scare. Meanwhile, an urgent international effort is underway to contain the outbreak as the virus-hit cruise ship remains under quarantine. An outbreak of hantavirus infections aboard a cruise ship has sparked growing international concern among global health authorities. As of May 7th, reports indicated that at least 3 people had died after contracting the hantavirus infection. The World Health Organization stated that by May 6th, 3 cases had been officially confirmed while 5 additional infections remained under investigation. Dutch authorities reported that nearly 40 passengers disembarked from the vessel during a scheduled stop at St. Helena. 1 infected passenger later returned to Switzerland, where health officials confirmed a positive hantavirus diagnosis, according to the WHO. Reports further stated that 146 passengers remained on board the cruise ship under isolation protocols as of May 6th. The developments were disclosed publicly by WHO Director General Tedros Adhanom Ghebreyesus during remarks on May 7th. Meanwhile, reports emerged that 2 Dutch nationals infected with the virus later succumbed to the illness. A statement issued by Dutch airline KLM on May 6th claimed that authorities had confirmed 2 deaths linked to the outbreak. One of the infected individuals had reportedly boarded a Johannesburg to Amsterdam flight before being removed from the aircraft. According to KLM, the Dutch passenger later died in South Africa after complications linked to the hantavirus infection. The KLM statement said, and I quote, "Yesterday evening, the Dutch Public Health Authority RIVM informed KLM that one of the Dutch nationals who died from hantavirus had briefly been on board a KLM aircraft in Johannesburg on April 25, 2026. Due to the passenger's medical condition at the time, the crew decided not to allow the passenger to travel on the flight. The passenger sadly later passed away in Johannesburg. KLM extends its condolences to the next of kin and wishes them much strength during this difficult time." The flight concerned was KL 592, codeshare AF 8282, DL 9560, SK 6855, which departed Johannesburg, JNB for Amsterdam, AMS, on April 25 at 11:15 p.m. local time. After the passenger was removed from the aircraft, the flight departed for the Netherlands. As a precaution, all passengers who were on board this flight are being informed by GGD Kennemerland. RIVM states that there are indications that the hantavirus in question, the Andes strain, can be transmitted from person to person. However, this appears to be very rare. Internationally, only a few such cases have been reported. Moreover, person-to-person transmission occurs only when people have very close contact with one another." End quote. The affected cruise vessel had originally departed from Argentina and was traveling toward the Canary Islands before the outbreak surfaced. Authorities subsequently halted the ship near Cape Verde, off the western coast of Africa, amid mounting health concerns. Argentina, Switzerland, the Netherlands, and the United States are now reportedly coordinating efforts to prevent any wider international spread. Hantavirus is classified as a rodent-borne viral disease that can infect humans through environmental exposure. The virus primarily spreads through the urine, droppings, and saliva left behind by infected rodents in contaminated areas. The most common mode of transmission occurs when people inhale air contaminated with virus particles from rodent waste. Certain hantavirus strains may also spread through close human-to-human contact, although such cases remain uncommon. Initial symptoms typically include fever, extreme fatigue, body aches, and persistent muscle pain during the early stages of infection. In serious cases, the virus can lead to respiratory failure, severe lung complications, or significant kidney damage. Although relatively rare worldwide, hantavirus infections can become life-threatening if not detected and treated quickly. Health experts advise avoiding direct exposure to rodents and staying away from potentially contaminated environments or surfaces. The World Health Organization currently assesses the overall global public health risk from hantavirus as low. A WHO official also stated on May 6 that the possibility of limited human-to-human transmission cannot yet be ruled out.
Hantaviruses are viruses that are carried by some types of rodents. They can cause severe illness in humans, and they can be fatal. While we don't often hear about them, there are thousands of infections that are estimated to occur globally each year. People are usually infected through contact with infected rodents, or their urine, their droppings, or their saliva. Human-to-human transmission is uncommon, though limited spread among close contacts has been observed in some previous outbreaks with one of the viruses, the Andes virus. WHO is working closely with authorities in Cabo Verde, the Netherlands, South Africa, Spain, the United Kingdom, and the ship's operators to coordinate actions to ensure the safety and health of all people on board, while also limiting further spread. WHO has informed all of our member states through our channels, our international health regulation channels. We are supporting the medical evacuation of the 2 sick patients who are stable on board, and we're coordinating with the Dutch and Cabo Verde authorities and the ship's operators. What we know typically about hantaviruses, I just want to put this in context, typically the exposure and the infection comes from contact with rodents. We have seen with one of the viruses, the Andes virus, that there has been some limited human-to-human transmission. Now I know that means different things to different people, but just to say that's really among very close contacts, which is what I'll come to your later question later, what we actually think has happened in the current context on the ship itself. The plan is, and our highest priority is to medically evacuate these 2 individuals to make sure that they have the care that they receive. So the plan, that is currently in the works, it's underway. The plan now is for the ship to continue on to the Canary Islands. We're working with Spanish authorities who will welcome the ship, have said that they will welcome the ship, to do a full investigation, a full epidemiologic investigation, full disinfection of the ship, and of course to assess the risk of the passengers that are actually on board. This was an expedition boat, and many of the people on board were doing bird watching. They were doing, a lot of things with wildlife. So our assumption is they were infected off the boat and then joined the cruise. The cruise did stop at many different islands up the coast of Africa, and again, seeing a lot of different wildlife. On those islands, there are birds. Some islands have a lot of rodents, others don't. So there could be some source of infection on the islands as well for some of the other suspect cases. However, we do believe that there may be some human-to-human transmission that's happening among the really close contacts, the husband and wife, people who've shared cabins, etc. So again, our assumption is that has happened, and that's why we are operating and working with the ship to make sure that anyone who is symptomatic, anyone caring for patients is wearing full personal protective equipment. The medical personnel who have boarded the boat have brought additional PPE as well. So that's our working assumption. There are thousands of cases of hantavirus that do occur each year from exposure to rodents, but there is one cluster in Argentina that happened a few years ago that we often refer to. It's uncommon. It's definitely uncommon. And again, when you have an enclosed settings, you have people that are spending a lot of time together, these types of things can happen. Right now, there aren't any specific treatments for hantavirus, but care is supportive. Typically, people will develop respiratory symptoms, so respiratory support is really important, particularly oxygen. Some require mechanical ventilation. So what we want, especially if patients are deteriorating, we want to make sure that they have appropriate level of care, they have intensive care, then they have respiratory support. What our working assumption is that it is the Andes virus. It could not be, but we're assuming that it is until we determined otherwise, because we do know that in the past there has been some limited human-to-human transmission with this virus. Point being, regardless of which virus it actually is, we do know that some of the cases have had very close contact with each other, and certainly human-to-human transmission can't be ruled out.